act is under a lot of criticism by civil society activists. And so this is a bad time. This is a bad time in Bangladesh.
Recently in Pakistan, so Pakistan every year has, for the past 3 or 4 years, it has been having a women's march every March 8th, every international.
I follow that, the Aurat March.
Yes. Yeah. Now, the Aurat March this year was slapped, the organizers were slapped with blasphemy charges of, raising slogans against religion, against religious characters. All of that was bogus. Let me put that on the record as well. But they used religion and anti-blasphemy kind of legislation to clamp down on what they felt was, moving away from our traditional religious values. Right? I'm wondering whether that kind of cultural imperialism or cultural fascism is also happening in Bangladesh in the same way. And I believe with Nupur, I'm going to raise the same point with respect to women in particular, whether that cultural fascism is also, whether that mirrors Pakistan's situation or not, or whether it's a different situation.
Should I speak first or Nupur?
Nupur is going to speak when she has a session, apart from if she wants to add to you.
Okay, let me just say, make it short then. No, I don't think one can, in my own view, it's not so black and white. It is much more nuanced in the sense that a government which claims to be committed to secularism has committed huge amounts of money from our revenue budget to a religious organization, which now recently has caused the government a lot of pain in the what. And so now suddenly the government has turned around and said, we have to contain these elements. So the government plays a game of hide and seek or whatever, cat and mouse with religious parties. So when it's convenient, the religious parties are their friends. When it's not convenient, they are not their friends. There seems to be no principled position about it. But what is on the forefront of the issues is not women, actually. Although this particular organization has made outrageous claims and comments and demands about women. At one point they said girls need not study beyond grade 4. And at another time they even said things, it's just ridiculous what things they say. But it's not so much what they say about women, but what they are doing in general that is causing a lot of anxiety to civil society at large, because they seem to have enjoyed the support of the government for a long time. The issue of blasphemy has not come up in the same way as in Pakistan and with the Aurat March. But I don't know whether we are heading in the same direction or not. I certainly hope not. But some of the elements are the same, and some of the elements are slightly different.
May I add something, Ahmed Yusuf, if you allow me?
Yes, absolutely, Afroza.
All right, thank you. I think we need to add a point from another perspective. I mean, if I could understand your asking, I mean, the culture we see in our country, the imperialist attitude, I mean, the repression as women we face, yes. The answer is, especially from Islamist group, they are always, it's pretty clear, it's clear like water. They always created obstacle in front of every move of, if you call it, let's say, their heritage. I mean, as you know that women, we don't have the same right like our brothers in our father's Srinapa, what is the word? Yes, inheritance.
Inheritance.
Yes, inheritance. So there are dozens initiatives. Srinapa knows it very well, but it was stopped every single time by Islamists, and it doesn't matter what the mosque they use. It doesn't matter whether they are Hefazotis, whether they are Jamaat, whether they are without any name. So it doesn't matter. They all sits under the same umbrella. This is as simple as that, number one. And number two, I can give you dozens of stories right now here that, uh, give me a second. It was January or December. Yes, it was December last year. One of my columns were published in BBC Bangla. I used to write for BBC Bangla. So after right now, you could go and check out. Uh, it was more than 1,000 comments. So almost more than 50-60% comments. The write-up was about third degree. It was a new interpretation from, I have come up with that new interpretation that the culture we have, it permit us wife beating, girls beating, and though we have a law to protect even the prisoners, the third degree, we apply it only for prisoners, but uh, in front of our eye, it is permitted. Wife beating, girls beating, in the name of this, in the name of that, it is permitted. So my write-up actually framed it, the idea of beating wives, girls, as third degree, and press that we need to take it seriously to stop it, and we need to come up with a new law to stop it. Under that write-up, that column, right now you could go and check more than 1,000 comments, and more than 60-70% comments were claiming that I myself was, I could give you three terms. Secular. It's Srinapa. You could understand what does it stand for. Secular, and it's plus bastard. You secular bastard. Number one. Number two, Neri Badi. It means not the feminist. So it stands for like uh, a, a bitch. Neri Badi means a bitch who talk for a feminist right. So another word, in my several write-ups, after my several write-ups, I have received a comment. Oh, new Taslima Nasrin. So this is kind of stigma you would find everywhere. So the question you asked, whether do we see any kind of cultural imperialism? Yes, we see, especially Islamist. Radicalization is one thing, and as Srinapa mentioned it, that yes, now we see Islamization is kind of, it's more intense nowadays. So I think it's a byproduct of that Islamization that women are going to face more repression in future. So yes, rather we should. We need to take this point very seriously. And we have dozens of stories, like say an actress, let's say Joy Astan. Go and check out, uh, um, any news. Or a few days ago, one of our biggest celebrities, Kaburi, she died out of corona, go and check out the comments, and most of the comments came from that ideological background. And I can give you another example. Our female football
Afroja,
players,
we
just
have
a second,
Nupur.
just a second, I'll be done.
Yeah.
So our female footballers, there was a demand that they need to be stopped and their schools were burned. So you see, we have a culture like this, so we can deny that we don't have kind of imperialism like that. So with that note, all right, thank you for giving me another chance. Thank you, Ahmed.
The only
Thank
thing
you,
I
thank you. I
will
wish I
say,
could listen. I could
Yusuf,
listen for hours.
Yusuf, if I can have 10 seconds, the only thing I will say is that it's not necessarily part of imperialism, it's very homegrown misogyny.
I agree. Actually, that gives me a great segue into India, because we've been seeing religion, we've been seeing misogyny and sexism, we've been seeing caste all come together in a very toxic mix in India. Based on that, and given the hyper politicization in India as well of coverage, Nupur, how do you find women's struggles and their concerns being reflected in India?
Well, if the UN Secretary General said that COVID crisis has a woman's face, certainly it is not being reflected in South Asia, all of it. Invisibilization, a word that we have heard repeatedly in the last 2.5 hours that we've been now together, and misogyny seems to be a heady cocktail in our region. And I'm not saying that it's not there in other countries as well, including the West. I think violence against women in COVID times has been reported in many countries, including the West. So let's not always beat ourselves up as being when it comes to women, we have a universal misogyny that operates. I think Krishanti Cosette, you will agree with me, because studies have been done when the Nirbhaya rape case happened in India. Studies were done in other countries, including places like US, UK, Canada, to look at whether such violent crimes were being committed. And they all showed some amazing results of what was the kind of crime, except that there in the West, there was a rule of law, which sometimes here we find absolutely lacking. So I've sort of digressed a bit, and I'm going to be brief because unfortunately I have to run. I have COVID crisis right here in my, and not here, I'm in Bangalore, but in Delhi in my family. So I'm a little distracted with from this thing of doom and gloom. As journalists, documentary filmmakers, we are always told that it's always doom and gloom that we present. Let me actually start with the happy story in India, which is that, when the COVID crisis started, the pandemic hit, one of the groups that got maximum sort of play, in a sense, and they sort of just came out of nowhere because they were there in the midst of our population. They were the health workers, large army of women health workers who went in, and they were called ASHA workers, community leaders, who were going into communities and talking about COVID, the crisis that it was presenting. And in fact, there were communities that were actually, physically even abusing them because they didn't believe that COVID actually existed, but they were willing to face all this. And it was just amazing. And I'm hearing similar stories from Bhutan. Bhutan has apparently got hold, just complete control. They have some 7 or 8 cases now because they unleashed this women, the women's army of health workers. So there are lessons in all this to be learned. But however, what happened, this good news story, which did reflect in the media, didn't stay on for long. And neither did media continue to follow the fact that all these ASHA workers and many of these health workers were not even being paid their wages down the line. The fact that they were working these long hours in difficult circumstances and not being paid. So follow-up was lacking. The stories of these people who were coming as COVID warriors, in a sense. There was, at one level, there was this hype about we must, sort of take care of the COVID warriors. But on the other hand, we were also seeing reports, and of course, print media was reflecting the fact that, in fact, even day before yesterday, we had a news report which said that insurance of workers is not being, of unorganized labor is not being renewed. Again, that was, of course, refuted immediately and said that, the government said, no, but we are going to do another scheme, etc. So there's no follow-up of what is going on. There was another good news story, which was our Kerala health minister. She was a woman, and she was actually a teacher before she came into politics. So her name was Shaileja. The people refer to her as Shaileja teacher. And she became like an iconic figure here, in our parts. And of course, you also had CNN, BBC, and others interviewing her, saying, how did you, because in the early days, although the first case was actually sort of found in Kerala, later on, they had an absolute control over it and all. Of course, things have changed now. There are many more cases, but less deaths. So, Kerala's model, I don't have to tell all of you about it. That seemed to have worked. And this amazing health minister did some great work. So these were really some good news stories that one was getting to hear in the early days, where women were involved. Women was center stage doing something really effective. However, down the line, and it's been a year now, we know that, and so many of them, you people, Shirinappa and others, and you have, Anna Froza, you've talked about the violence, the domestic violence that we have seen among women. That has really escalated in a sense. So I won't really dwell on that, except to just share with you one really gross thing that happened the other day, where a man came on the road and just stabbed his wife in full public gaze, and nobody dared to come in front and sort of defend or help the woman, because he kept brandishing this knife around. So they all sort of stepped back. But interestingly, the story doesn't end there. Later on, people used that image of that woman lying stabbed on the road in a complete fake morphing. They put the face of a woman journalist on her, and they showed it was a kind of an intimidation tactic to show that this is what will happen to women journalists if they don't sort of fall in line, if you want to put it that way. So it was crazy. I mean, here was this episode between a husband and wife, and absolute gory violence on the main road. And later on, somebody actually, with a twisted mind, morphs it with an image of a woman, a woman journalist, and that woman journalist is safe. And it really horrified us. And this kind of misogyny of the worst kind coming to the fore in these times where people are going through so much of suffering. In the initial days, there was some gaze on the women migrants that were walking back, the terrible, just the pain, and there were journalists who were out there on television 24/7, really bringing us the plight of the migrant workers and what they were going through. You had these stories of these women carrying their children on their backs and walking 600 kilometers. I can barely walk 3 kilometers now and I'm panting, and 600 kilometers. There was a young girl, 15-year-old, who cycled with her father for over 1,000 kilometers or some such thing. I mean, I don't remember the kilometer, but it is ridiculous, those numbers, those figures, and what these people went through. Some of these stories did surface. The journalists did go out there and chase these stories and bring them to us. But again, somewhere down the line, it started waning. And now we are in a state where, today, what I'm carrying with me are the wails of women, mothers, daughters, sisters, crying for hospital beds, for oxygen, this kind of trauma that women are going through. I don't know how long it's going to take for us to really get over this trauma. the the joblessness of the unorganized sector. I don't think the media has done justice to that. The kind of job losses that has been for women in the workforce, in the unorganized sector. And even in the organized sector, if I look at it, if I want to just quickly jump to my little chapter on women journalists, so many newspapers have retrenched. They've used the cover of COVID, and some really leading newspapers from whom we did not expect this kind of action. It has happened, even from them, where they've just used this as an excuse to retrench journalists, working journalists. And as you know that, the next day, hire and fire, and you're out on the street. And so many women journalists have lost their jobs in the pandemic. There are others who've been to the field and tried to do truth telling, as we ought to do. I mean, that's really our Bible. But they've been threatened with FIRs for telling the truth, for saying that the government has slipped up on offering relief to the people in the pandemic. They've had FIRs, which they've had to fight. And both men and women journalists. I'm mentioning women because, we are looking at, our session is with a gendered focus. So that's why I mention it. Online, offline attacks on women journalists have really gone through the roof in this 1 year. I mean, there's no time now to actually go into that. But honestly, what Tasneem, you have done with your AQS report, I really think that the rest of South Asia, we ought to be doing. There have been research like this in patches, as you said, even in Bangladesh, in India too. We've had organizations that have looked at different aspects. We really need to collate all this and bring it together. And maybe we could have a big South Asian picture on this whole thing. Maybe CWGL could lead that effort. Tasneem and I actually go back 21 years.
Yeah.
See now, first time I've made Tasneem laugh at least. 21 years, we shot a film called, where we looked at the impact of satellite television in South Asia in the year 2000. Now we are revealing our age. We're very young still at heart. But yes, I mean, and there I was filming in 5 countries, Sri Lanka, Nepal, India, Bangladesh, and Pakistan. And in Pakistan, I was trooping with Tasneem, younger versions of us, right, Tasneem, to Peshawar, Lahore, Islamabad, Karachi. And we were looking at the impact of satellite TV. 21 years later, we're looking at the impact of COVID on gender. It's interesting. We're alive today, and I'm happy to have shared some of my distracted thoughts. It's got a bit late. My mother-in-law has got COVID in I just have to attend to a few calls, but I just wanted to say that the media has really not. Media, in a sense, has also changed the economy story. The impact of COVID on the economy. They followed the government's lead on that. And that's really not the story. What we see is the story of human suffering. And that story of human suffering, it has happened, it has been done in patches, but really it is the overriding story, right? Whether it is in Pakistan, whether it's in Bangladesh, whether it is in India or Sri Lanka, the fact that, in this time we are indulging in prejudice, we are indulging in hate speech, we are indulging in misogyny against women. How is all this? I mean, how is history going to forgive any of us for doing what we are doing? And media for actually being blind, having blind spots on these and not really pointing out. Again, I want to say there are amazing journalists who are still really, really fighting it out there and bringing out amazing stories. You cannot paint with one brush everyone. But the kind of suffering that we are seeing from women farmers, women workers, women fisher people, the poorest of the poor. Okay, we are all sitting in our comfortable homes. Whatever it is, we have security. All those who have no security, what is it that we have done for them? Did the media do enough? All our media in all our countries, or did we just run after the wrong stories?
Yeah.
This was wonderful. Just it left me with more questions. If you have time for questions, I can ask those questions. The others can ask those questions. Nupur, how much time do you have?
I mean, I speak very fast, so I'll answer your questions very fast.
Okay, so I'll open the floor for the others first before I ask my question. Anyone with questions?
Not questions, but maybe a comment. Nupur, I think those stories that came out about that first lockdown, that first sudden abrupt lockdown and what it did to workers, and those 600-kilometer journeys and 400-kilometer journeys, and those, even the photojournalists, those pictures of the sandals everywhere, strewn everywhere, the feet, uh, cracked feet of the people who had walked and walked and walked and walked. I think I would have wanted to think that those stories would have an impact on our government so that when it announced its lockdown, it would think about those people first. Unfortunately, not. I think it affected a lot of us, those stories that came out of India in the beginning, and the pictures as well. Uh, but again, we have just recently announced a total lockdown without once thinking about what is going to happen to the street vendors, what is going to happen to the rickshaw pullers, what is going to happen to, the vendors who go around with vegetables or everyday items. Uh, no thought at all, no thought at all. And I wonder why our governments get away with this year after year after year. And, there's something we are doing right.
Shireen,
There's something we are doing right.
So Shireen, I just wanted to say, what my feelings are about this. Okay, I mean, I am not opposed. I don't think it's lockdown that is a problem. If people are dying, in UK, they've just been through a 6-month lockdown, and they have brought down the death rate from, a crazy number when they had the UK variant hit them again in the second wave to a very, very low number now. My sister who lives in London said, I was talking to squirrels in my garden for 6 months and then moving between Zoom and, and this kind, so this is it. I mean, and they're just about opening. The interesting thing is that their governments are giving relief to the people. Okay, in the US, you are giving relief. We have states, they do not believe in welfare. This is the question and we do not ask those questions. Journalists do not say. In fact, you have financial journalists who say, how much of subsidy shall we give people? How much of, it's always about the market. It's always about the wealthy. It's never, that is the problem, that we have governments that will not do anything for the welfare of our people. If these people had been given the money and then sent back and they told, okay, rest now, this is it, you need to protect yourself, life is more important, but here's the money that you can have to make sure that you don't go hungry. But no, we didn't have that. I mean, 500 rupees for 3 months, I mean, give me a break, You won't even give 500 rupees to a beggar now because you don't know what they're going to get at the end of it. I'm sorry. I mean, I just get livid when I think of how our governments get away with their complete disregard and their complete ignoring of the poorest of the poor.
Can I tell you a story, a very short story in 20 seconds? This is from an informal market in Karachi.
Ahmed, you're a journalist. You were a TV journalist? Because our sound bites came down to 20 seconds at one point, 15 seconds. That's when I quit television.
I was a print journalist. I was an investigative journalist at Dawn.
Yes, okay.
Okay, so we came across a story of a woman who was outside Empress Market, which is one of the colonial markets in Karachi. And basically, she had struck a deal with the local policeman. So the local policeman during lockdowns would actually take a fraction of her earnings every day, but would let her, do business while the men were being beaten up. So what she had done was basically invert culture to her own advantage. And I thought that was beautiful. I thought it was very smart. But that also gives us a nice segue into the US, since we are talking about the US. Hello, Dr. Cosette Thompson. Cosette, we can't hear you.
Yes, thank you. Ahmed, I have a question first. I'm concerned that some of the speakers that were going to come after me, if they have to leave, that we give them priority, because I can stay for as long as needed. So,
Absolutely.
So we could ask if anyone needs to speak now before I do.
Hi, Sarah. Hi, Rose. Would you like to go earlier?
Hello, Sarah here. I would like to go earlier, please, if that's okay.
Yes, Sarah, it is.
That's perfectly fine.
I also have another meeting. If I could go after Sarah, that would be nice.
Perfect. We can do that.
No
All right.
problem.
So the floor is yours, Sarah.
Well, thank you very much, and congratulations to UX for this new resource. I know that media monitoring is not easy, and analyzing the mountains of data is a tremendous task. So thank you for this space to bring in lessons from the GMMP, or the Global Media Monitoring Project. Thank you, Tasneem and UX, for the invitation. Thank you to Ahmed and Shaista. I learned a lot about the background that helps us understand the findings. Now, not everyone may be familiar with the GMMP, so I will introduce it briefly. The GMMP is a research and advocacy initiative for gender equality in and through the news media. It brings into focus concerns about gender disparities in participation in the mainstream news. It brings into focus concerns about inequalities in freedom of expression and the extent to which the news media worldwide are faithful to basic ethics and standards agreed within the industry. We know that fair and balanced portrayal of all people, representation without sexist stereotypes matter. And these are a hallmark of professional journalistic practice. And this is the angle through which the GMMP tries to make an intervention. The GMMP rose out of frustration with the media's seeming lack of respect for women, sexualization and objectification of women's bodies, and trivialization of their opinions. Participants at the first International Conference on Women and Communication that was convened by WAC and the International Women's Tribune Center and ICIS Manila in the Philippines. This conference was held in Bangkok in 1994, and the participants decided to organize one day at the start of 1995 a global monitoring. Since then, this monitoring has taken place once every 5 years and has given the world a one-day snapshot of women and gender in the news media. The 6th edition just took place in September of 2020, and at the moment we are all in India, in Pakistan, in Bangladesh, and globally all over the world in about 120 countries, working on our reports to launch them in June. One of the GMMP's objectives as a time series study is to compare change over time, and these results are published in Who Makes the News. So we are aiming to have a launch of the global, the regional, and the country reports sometime in June. So please watch this space, www.whomakesthenews.org for the report. But UX will also have a copy, and we'll be able to send this to all the participants. Altogether, we had just under 120 countries take part in the current edition, out of which 16 were from Asia, including Pakistan, Bangladesh, India, Kyrgyzstan, Myanmar, and a number of others that have been part of most of the GMMP editions. As we are all aware, 2020 was no ordinary year, and it certainly wasn't one for the news media. The news were replete with stories about the pandemic, the numbers of those infected and those who had passed away, stories of loss of life and loss of livelihoods. And as was so poignantly stated, really the story was one of, human suffering and not the economic story that the media have been chasing. So a tweak that we integrated into the data collection tool allowed us to classify pandemic stories under a secondary topic such as politics or economy, therefore making it possible for us to do the usual cross-year comparisons. So by the Global Monitoring Day, the pandemic stories were tapering off. And in fact, only 1/4 of the total sample were related, of some 30,000 to 40,000 stories were related to COVID-19. Now, the past 5 years have seen small incremental changes towards parity in subjects and sources, particularly in broadcast news. At the same time, the pace of change remains glacial. Between 1995 to 2020, the largest strides towards parity in subjects and sources have been in radio news, and the smallest change has been in television news. And we know that television has been so important during the pandemic, as everyone, tries to look for reliable information on COVID. Nevertheless, we found that print news and radio newscasts tied in terms of the proportion of the people who are seen, heard, or spoken about who are women in the stories. What is startling about the GMMP numbers, and I'm going to really just focus on Asia and mention some of the global results. What is startling about the numbers overall in the period since 1995 is just how slow the pace of change towards parity has remained, considering that women are half the population and the numbers of those participating in the public space have increased considerably. It is clear that the news media still have a long way to go to reflect reality. And I would like to say this, that the statistics that I cite are important for lending strength to all the anecdotal evidence, a lot of which we have already heard in this session. In Asia, the regional average currently, women are 21% of the people seen, heard, or read about in print, radio, and television news, which is actually a marginal improvement from 5, 10, 15 years ago, and better than 25 years ago. However, Asia has consistently been below the global average, and usually tails all the regions together with Asia, together with the Middle East and Africa. Those three are usually at the bottom three. Now let's skip to the findings on stories related to COVID-19. In Asia, 21% of the total stories in traditional and digital news media, and when I talk about digital news media, I'm talking about internet news websites and Twitter news. These are the news tweets that are from news media organizations. So 21% of all those total stories had a COVID-19 angle. And from the highest was in radio, that had 27% of the stories on COVID-19, to 15% of the stories on news websites. As I mentioned, we were able to classify all the COVID stories under a secondary theme. And the secondary theme related to science and health was most likely to also have a COVID-19 angle. That's not surprising. 60% of the science and health stories had a COVID-19 angle. But those about crime were least likely to have a COVID-19 theme. Actually, only 6 out of 10 of crime stories. Not that there were no, so there was no stories in Asia that were identified as pertaining to gender and related issues such as sexual harassment against women, rape, sexual assault, trafficking of girls and women, and the gender pay gap, which was surprising. But this does not mean that there are no such stories in the media, for it is in fact through the media that we learn about these crimes. What it means is that such stories are less likely to make it to the main news pages, meaning they are less likely to be ascribed news value by newsroom decision makers than other stories. Women were 47% of the journalists in the COVID stories across Asia, so that's almost nearing parity. And women were 14% of experts in COVID stories, compared to 19% in all stories. That means there were slightly less women in COVID stories identified or taking part in the news as experts or interviewed as experts. In fact, in Asia, 1 out of 6 health experts in COVID stories is a woman. This gender composition of experts in the news is partly a reflection of the physical world in which women make up the majority of health sector workers, but they are underrepresented in high-skilled jobs. Nupur, just before me, talked about the COVID warriors or ASHA workers in India. But this underrepresentation of women as health experts is also partly a problem of the media gender bias, given the gap between the sex ratio of health experts in reality and the same as expert interviewees. In fact, I looked at the OECD statistics to understand what percentage of doctors in Asia were women. And the percentages range from like 30% to over 50%. So that really 1 out of 6 is really a severe underrepresentation. Let's look at the gender lens in the stories. One would expect professional journalism, which is the news, with a COVID-19 theme to be more careful about integrating a gender lens, considering the now common knowledge that gender inequalities have become more pronounced as a result of the pandemic. Surprisingly, stories that are not about COVID-19 are more likely to challenge gender stereotypes than stories related to the pandemic. In Asia, for example, 2% of COVID stories clearly challenge gender stereotypes, and these range from 4% of stories that have a secondary theme related to social and legal issues. That is, stories that are about education and COVID, or migration and COVID, or religion and COVID, or disasters and COVID. So 4% of those clearly challenge gender stereotypes, which was the highest. And stories with the secondary theme of crime, that's crime and COVID, 0% actually challenge gender stereotypes. Again, in the region, only 3% of COVID-related stories clearly highlight gender equality or inequality issues. Interestingly, 9% of crime stories do this, while, as I just mentioned a few seconds ago, no crime stories clearly challenge gender stereotypes, which is interesting, that a story will highlight gender inequality issues, but not challenge gender stereotypes. So that is a point for discussion. And given the time, I think I should stop here, but just to say that these and many more statistics will be published in the final report on whomakesthenews.org in June, as well as in the regional report, where we will have more statistics and analysis from Asia and the rest of the regions. And in the national reports, I'm expecting a report from Pakistan, Bangladesh, India, and several other countries that took part in the GMMP. Thank you.
Thank you, Sarah. The figures are far more horrifying than I expected them to be. But I think that is also capturing reality far better than that. In fact, the RRI that we have kind of developed, that index might be very, very crucial to discovering the fate of each story that is actually generated. So if we look at reported crime, and reported crime being generated from the police station when the report is lodged, we can potentially, I mean, we've been working on this, but what we are trying to do is we are trying to tag each reported case with a particular number, and then kind of seeing, you know, what happens from the police's end, and what happens in terms of courts, what happens after a verdict is delivered, what happens in terms of any kind of psychological first aid or any kind of psychological help that is provided. I mean, we are trying to kind of develop that kind of system in which each and every person is then counted for. It's not merely just numbers anymore, right? I think in terms of data work, a lot of times, a lot of us focus on the numbers a lot. Sometimes we miss the story. Sometimes we miss what happened to individual people in individual cases, right? What we know is that there's a graveyard of missing stories. In Pakistan, there's a huge problem of missing people. But now we also are looking at a greater problem of huge missing stories in terms of rape cases, in terms of domestic violence cases, in terms of acid crimes, in terms of honor killings. There's a variety that is completely missing from media reportage. And I think to kind of go and tag these cases and make sure that they reach some kind of logical conclusion which is beneficial to the woman and which delivers justice to the woman concerned, I think that should we need to have a certain discussion on that as well. Tasim, are you here?
Yeah, I'm here. Very much here.
All right, perfect. So in terms of the rest of the world versus Asia, do you find things to be fairly similar in terms of Pakistan, India, Bangladesh, Nepal, Sri Lanka?
Well, I can talk about the comparison with other regions. I haven't looked at the comparisons across the countries in the region, but in terms of comparisons across the regions, Asia usually and has consistently historically been one of the bottom three in a number of these indicators of gender equality, on stereotypes, stories that clearly challenge gender stereotypes, on stories that have, in which women are central. Asia, Middle East, and Africa tend to be the bottom three, and that has persisted across time. But the global report will be the space to look at these statistics more closely, and the regional report will be the space to now do the cross-country comparisons in the region.
Perfect. We look forward to it. This actually provides us with a nice segue into Rose. Rose, are you here?
Yes, I am here.
Perfect. Rose, can you build on Sarah's talk and just talk about how we're seeing things in Africa? I mean, what I gather of social media is that women, like in South Asia, where you have preferential treatment for even things like PPE coveralls and masks. I mean, the thing in Africa that I'm noticing in Ghana, in Kenya, in Nigeria, is that a lot of those things are also being reflected there. It's a similar situation in terms of gender. Do you find that to be the case? And secondly, what kind of stories did you come across that took you by surprise?
Well, thanks first of all for having me here. I need to say that I'm here on behalf of my colleague and friend Catherine Gisheru of the African Women Journalism Project. She had to attend a meeting and asked me to step in for her, but I've enjoyed this very stimulating conversation, and I thank you and commend you for the UX report. I think we see a lot of correlation between what's happening in Africa and what's happening in Asia from the stories that I'm hearing. Very, very much would agree that there are elements of remarginalization of women by the media when it comes to dealing with new challenges presented by the pandemic. In terms of voices, we heard Sarah's report talking about the discrepancy. I'll speak for Kenya, which is where I work. We see many of the broadcast media, they do make an effort to bring in women as experts, but it's more of a numbers game. It's kind of
You've lost
and finding who matter to speak to the potent issues. So we end up with having a lot of underreported issues, just like what I've been hearing from colleagues in Pakistan and the rest of the region in India. we don't really hear how the pandemic is impacting women, or if it is impacting women more than men. And there's no real effort to apply a gender lens on how women and girls are coping or not. I think this framing, apart from the dominant focus on the economic aspects of the story, it's created a problem in Kenya because we're evolving a situation where there's a big gap in public perception and responses to the pandemic. You find a real kind of resignation among the lower socioeconomic classes where women are disproportionately represented. They don't believe this is an issue. They don't believe it exists. They believe it's a problem of the rich. And that's because the media tends to frame it in terms of hospital beds and oxygen availability, access to healthcare, things that best of times, many of them are not able to access. And then you have like the disproportionate victimization, let's say, of populations where women are disproportionately represented. So you find like security officers in the enforcement of COVID-19 control measures, you'll see images of market women being, harassed, attacked, beaten, arrested, you know. You talk of stimulus packages which are targeting middle class type of people. They're promoted through means that will never reach the grassroots, as you say it. It'll never reach the roadside hawkers, house workers. Many house workers have lost their jobs because people don't want them in their house anymore. And so we're not hearing these stories of stigmatization of people who make their living outside and through contact with people. People don't want to deal with people who deal with too many people because of the way it has been framed. I would agree with much of what has been said, and I don't really want to repeat too much of what has been said about the rise of gender-based violence and lack of services. It was very interesting to hear Shireen locate it so specifically as the inability of media to make the linkage between the upsurge of violence and the culture of misogyny. She put it perfectly. You could have been talking about Kenya and you wouldn't have missed a beat. And I think all of this has very, very risky, very potent implications for what comes next, because now we're talking about vaccination, we're talking about access to information that is timely, that is useful, that it reaches people where they are and takes into account the specific risks that they face and are likely to face. I want to speak therefore a little bit about what's happened in the media in Kenya. Like in your region, we've seen a lot of newsrooms laying off staff. Majority of those impacted are women. While the media houses will always argue, oh, we're laying off men and women in equal numbers, but you start with lower numbers of women in the media. So the impact of removing one woman from a newsroom is it's untold. I was speaking to a woman in Turkana, which is in the northern part of Kenya, and she is one of only 2 women who cover the whole county. Both have lost their jobs, so literally you have no women covering Turkana anymore. And they're moving into different areas now. They're, doing petty hawking to survive, and they've given up what they used to do. Even if they try to do freelance work, they're looked at suspiciously. They're looked at as people who move around too much and people to be avoided. And then I think, again, we speak of what Afroja mentioned about the online attacks against women and the upsurge of that against media women. Huge impact The Association of Media Women did a study on it. Tara supported that. Really just looking at the disproportionate number of attacks against women who dare to have an opinion. And, you know, what does that do for censorship, self-censorship, and for reporting? The job cuts, again, in Kenya, we also asked the same questions that Nupur was referring to. How much of it is an excuse? How much of it is really because as an impact of COVID, and how much of it is reorganizing? You know, it's a good excuse, but we can't really ask those questions. So again, within the newsroom, we're seeing the rollback on the status of women, the gains that were made in getting more and more women in, getting more women into higher positions are being eroded, salaries are being cut, and there's not very much that we can do. Some of the hidden things that come out when we talk to media women in Kenya, and we see as one of the part of our agency within the media to get more conversation around the status of women. And when we speak to them, they talk about being the first to be sent home. So when you have a skeleton staff in the newsroom, again, they've been removed. And the preference, out of sight, out of mind, preference for coverage, preference for any opportunities, it's almost as if COVID has recreated what we had before. I also want to just mention in passing, because all of them say, while COVID has largely been bad for women in the media, they all don't want to lose what COVID has given in terms of recreating family. So it's not a complete payoff, but they all say they really don't want to lose all of that, and how do we transform that into whatever comes next? So just a few thoughts. A lot of what has been said correlates very, very closely with Nairobi, Kenya, and so I will leave it at that.
Fabulous. Do we have any questions for Rose? All right, Rose, I had one.